Hello, my name is Dr. Alenkhe. I'm a senior registrar in the Department of Psychiatry, Lagos University Teaching Hospital. And today I'll be talking about substance use disorders. So psychoactive substances are chemicals that work on the brain. There are different classes of psychoactive substances. There is the legal, there are different classifications, can be legal or illegal, can be based on the effects they have in the brain. So for example, stimulants, example of that is cocaine or hallucinogen, example of that is cannabis, depressant, example of that is opioid or also cannabis. So and legal is alcohol in most countries, then illegal is cocaine. An example of that is cocaine. It's important that we talk about substance use disorder because it is becoming common in Nigeria. Statistics states that about 25% of people have problem with substance, but a little above 40% of youths use substance or have used substance before in the past. Okay, so it's not everybody that use substance that end up needing psychiatric evaluation. For some people, the predisposing factor can be genetics and can also be the type of substance that is used, the level of substance that is used also, among other things. Some of the symptoms to look out for in yourself or anyone around you or your family or friends. Number one, if the person has strong urge to take the substance, whatever the person is doing, the person has to drop it and go and get that substance at that particular time. Can be cannabis, alcohol, cocaine, heroin, any substance at all. Or the person cannot control the level at which he uses the substance. He's using more than he intended to use, or has even tried in the past several times to stop substance use and has not been successful. Or the person has been diagnosed with one particular ailment as a result of the substance use, either physical, mental, and even with that, the person still continues to use the substance. I'll use alcohol as an example. So for someone that has been using alcohol persistently and then has been diagnosed with having alcoholic liver disease, but still continues to use as alcohol as a result of this, yes, this person should speak with a mental health specialist. Also, after using more after a while, so the level that the person used to take is no longer sufficient for the person, and the person has to increase it to get that particular effect from it. Yes, that is also one of the symptoms of substance use disorder. And then also, when the person has some physical symptoms, either physical symptoms or emotional symptoms, when they've not used the substance in a while, or when they reduce the quantity of the substance that they take, this is another symptom. And also there are some things that we call substance-induced disorder. For example, when the person has some unusual experiences like hearing voices of unseen people in clear consciousness as a result of substance use, or if the person develop mood symptoms, either low or high mood as a result, or anxiety symptom. This is an example of substance-induced disorder. So if you or anybody you know has any of these symptoms that I just listed, then you should reach out to your mental health practitioner. And these are some of the services that we render here. So the treatment is a treatable disorder. And then the treatment includes, for some people, we advocate total abstinence, for some people, substitution, for some people, harm reduction, and for some people, they will need medications. And all this we render here at Lagos University Teaching Hospital. So thank you very much for listening.